Hi, welcome to Renew Education. We are looking at a case. We're looking at an upper hybrid that's been in here for some years. And we're looking at the entire case. So there's another video for the lower that I addressed. I kept the implants in from the lower video just to kind of show you the path that we're taking on this. Just a 4 implant, single locator or 4 locator overdenture case. Make life very simple and straightforward. To me, hybrids are very much overly killed in terms of complication. You've got multiple screws, you've got the metal bars, you got plastic that's fixed. You got a fixed hard plastic. Patients can't chew hard on it or they pop the teeth off, they crack things. Screws loosen, you've got multi-unit abutments. I'm not a fan, and in this case, I'm really not a fan where the doctor didn't take this tooth out and add an implant over here for the hybrid. That would have been far better to get him the 12 teeth, leave the second molars. But he left this one so it would rot. Not a good idea. This is rotting here. This patient has dry mouth, and it's not looking pretty. So let's look at the treatment assessment that we did for the lower. It pretty much applies for the upper. We have a lot of grains here. So this is a really great case for a skilled person that wants to do an upper or a lower full arch case, but we're really going to examine the upper and the bone density, facial bone, bone constriction, eye nerve, bone characters. They're all greens. So that's all awesome. We also have orange on a sinus bone because we are going to get close to the sinus here, and the detached gingiva is all yellow, but that's all fine. Nothing extraordinary here. But it is a really, really good case. Now we do have some bone loss looking up here and here, so it's not surprising that this patient might be having some ailing problems with these implants around the upper hybrid. Let's look at the CT here. If we look at, let's say, implant by implant, well, let's look at the one that needs to be fixed. Let's look at number 14. And that's going to look like this. Let's get rid of some of these lines here. Not bad. The bone looks a little bit kind of chunky. Let's get to where we actually see a root. And it looks like the sinus floor is up there. It's kind of soft. And this tooth just takes up a lot of bone area. So when this comes out, I don't know what you're going to have in terms of quality of bone around that, how much is there. I would guess that you're going to end up with, if you graph this case, something around here, maybe about there, and then you're going to end up probably from here to here. So you might have about 9 millimeters. I would say you definitely want to put in a 5 by 10, in my opinion. You want to just get to that floor of the sinus, maybe a little bit past it, not much. That would be fine, and do something like that. But I would say graft it first, see what you think. It looks like he would heal around that. Looks like that would work out okay. That would totally suffice for what he's doing, and you cover all your bases. Would I recommend this tooth being taken out if it doesn't have any decay? Probably yes. I don't really need more problems down the future after you're doing surgery here. This is coming out. He's got his 12 teeth going on from here to here. So that's going to suffice. Now let's look at the implants across the board here. How did it go? Where is it at? Well over 5 years from what I understand. And all right, let's look at that. So let's get rid of some of these lines. So here we go. So he's losing, there's a little bit aggressive of an implant. It's a little bit wide for what the arch once was. It's got a little bit of bone loss, nothing major, but it will continue, and it looks, this is really hard to tell exactly. It's probably here is where the top of the implant is. I'm not sure. But he's got about 1 millimeter bone loss. There's a little lip there. I don't know if that's a thread or if that is, then it goes to micro threads. I think that's what's going on here. So let's go to the next implant here. And why does that look so weird? I'm not sure. It's kind of weird why it's showing up, getting some really weird rebound effect. Things were done pretty well. He looks like they probably used a guide or something to do this. Well, I guess that's it right here. So here he's lost a lot of facial plate. On this one, there's really not much there that you could tell, at least from what I could tell from the x-ray. Now, it doesn't mean that there isn't bone there. There's probably bone there. It just means that the x-ray obliterates it out. This is why you can't see that there's actually healing around an implant, etc., etc. But that might be the bone right there. Comes up to, I don't know, goes only to here. That might be very close to where the top is. So that one might not be missing much bone at all. And as we move along, same thing here. You get all this blackout going on here. So once again, I think these implants are a little bit big in diameter, a little bit aggressive for what kind of bone he had. Because I'm looking at that bone, it looks wide, but for some reason it looks like those implants are very wide. Here's a more narrow one, which is what I liked a little better, but it was probably because it's narrow and the very thin facial plate here. And he definitely has bone loss here going on. Here's a screw, here's a screw. So it gets more complicated, like I said, and your screws start to loosen and you got bigger problems. There is a Loctite that you can use for the screws to help hold them in, make sure they don't. And we're talking 3, 5, 10 years later that these screws start to come out. So it's hard to tell on a hybrid exactly which screw might be loose first. You usually don't notice for a long time. Here's definitely an Ailing implant. We're at the floor of the sinus here that comes down, so he punctured a little bit into the sinus. But here's where we have an Ailing situation on that posterior tooth or implant here. So you just got to keep it clean. Not much you can do there. Maybe have somebody kind of sterilize it. Clindamycin's a good one. And then you got to leave it. Some people want to always try to graft around it. It doesn't do that much in terms of health of that tissue, but you can graft around it, help hold that tissue a little bit longer. So nice case up here. I think the implants are a little bit aggressive in diameter, but otherwise it's been holding very well. He hasn't been chewing very hard because his teeth are all collapsing. So he has not been chewing very hard, so he hasn't any fractures on this hybrid at all. And I think it's just because the lower is collapsing, he has nothing to chew it on. So that's kind of been a savior for the upper. Now that we put something solid in here, it'll be interesting to see how well he actually bites on that. So that's about it for this case study here. Very straightforward. Please look at the lower and look for us in our live streams, and please give us a comment and please interact. Let me know what you think about what I am talking about in terms of these cases. It's always interesting to see what other doctors think about treatment planning, that kind of stuff. It's so important, and so important to notify and look at things historically as well. So we do have follow-up information for this one. And that's about it. All right, thanks a lot. Please join us, like us on Facebook, and subscribe to us on YouTube. And we will get back to you